Now, have you ever tried that before? Like focusing the light from a flashlight or even sunlight so that it converges exactly on a single point. Radiation therapy works in a similar way. There, an energy beam is focused and directed into the body from outside. The beam is aimed precisely at the cancer cells and destroys them. More specifically, it damages the genetic material in the cells. The cancer either disappears completely or at least gets smaller. Now, when many people hear the word radiation therapy, they get really scared at first, connecting it with radioactivity. Don't worry. Even though radiation therapy is sometimes called radiotherapy, it has nothing to do with radioactivity. The rays used here are not radioactive, and you don't feel them. So, what are these different rays? There are two different types of radiation that can be used in cancer treatment. On the one hand, there are high-energy X-rays. These are also called photon rays. Or treatment is done with particle radiation. These are electrically charged particles, and one example is proton radiation. But no matter which method is ultimately chosen, the goal is always to target the cancer as precisely as possible while protecting the healthy tissue as much as possible. Proton therapy is especially common in children and adolescents. Protons are charged particles. You can imagine them like arrows. The radiation doctors can precisely calculate the trajectory of the protons and determine exactly where they will land and release their energy. Namely, only where the cancer is located. So you could say it's like hitting the bullseye, or in this case, the yellow center. The tissue in front of and behind it, that remains, largely unaffected. Protons offer particular advantages, for example in the case of brain tumors. In the brain, very important areas are located very close together. You really don't want to damage anything there, so you need the highest possible precision. In principle, for tumors in children and adolescents, it's always checked first whether proton therapy is possible, and also whether it would be helpful. That depends entirely on the individual illness. For example, there are also cancers. Cancers that need a particularly high radiation dose, and you don't necessarily need proton radiation because there is no critical tissue nearby. That's the case, for example, with bone sarcoma. Or sometimes very large areas need to be irradiated, such as the entire lung or the pelvis. In those cases, it can also make sense to use X-rays. So, which type of radiation therapy is suitable for whom depends on the individual case. Your treatment team will take a very close look at which approach is best for your personal situation. This is always evaluated individually. By the way, we'll explain in more detail in another video in which cases radiation therapy is even an option. In other videos, we'll also cover how a therapy session actually works and what else you need to keep in mind. We've also made a video about the possible risks and side effects of radiation therapy. Those are part of it too, and it's important to talk about them openly. The good news is that radiation therapy is constantly being improved. Especially in recent years, there have been major medical and technical advances which have made it possible to reduce the radiation dose and therefore its side effects in many cases.